bringing those jaws forward, elongating them, is going to give a V-shaped appearance to those mandibles and make the jaws look wider. Torquing the condyles is dangerous. It's a dangerous thing to do, and it puts the TMJs at great risk and causes a lot of morbidity. So I would try to avoid widening here and flaring out the condyles. And actually, when we do custom surgery, I'm able to control that proximal segment. The proximal segment is the part that's attached to the condyle. So when we split that mandible, bring it forward. The nice thing about planning it and making a custom plate is that I know when I plan it and I keep that condyle neutral and make that plate adapted, I know for sure that I'm not going to swing that condyle out of position. And there's no way to know that with traditional surgery. So I'm glad you brought that up. So what happens is a lot of, and I'll still look at this and this questions come up, is that TMJ is a big risk after jaw surgery, right? And TMJs get worse and all those things. And it's true if that condyle is torqued out of position. And with traditional, there's no way to know when you put a plate what's happening to that proximal segment. It's impossible. With a custom plate, you know that if it's flush, you haven't moved anything. So that's a great point. Now, in terms of widening, orthodontic, widening as much as possible, we try to take advantage of. I expand the maxilla a lot, with
orthodontically.
No, surgically.
Okay.
Surgically, because that's a very safe thing to expand, and we usually will try to widen the lower jaw arch orthodontically. And most of the time, the narrowing, because of the way these things are developed, is more so in the maxilla than the mandible. So most of the time, the lower teeth are tipped in and narrow to match the narrow upper arch. So when we widen the upper arch orthodontically, we can widen the lower arch without having to do anything with the condyles, but still get a better widening of the jaws.
Right.
So yeah, that's the answer on that.
So I think a lot of people struggle with this idea that by advancing the mandible, you're widening it. In the way tell me if you agree with my way of demonstrating it. I often say to people, okay, look at my chin when I do this, right? You're not seeing my jaw. But
Correct.
Then when I go like this,
yeah,
now all of a sudden I have a big jaw.
Yeah.
So there's a lot of jaw that's hiding in the neck when it's recessed. And you're basically just bringing the wider part of the jaw into visibility.
Yeah, that's a great way of putting it. And it's demonstrated. If you look at most of the before and afters, look at all of them, their angles look wider after that advancement. Now, the other thing about widening arches, something called SFOT. I don't know if you've heard of that, but surgical orthodontic therapy. And what we can do is, if orthodontically, if there's not enough bone to tip those teeth out and get them where we want, we can do SFOT, where we make corticotomies in the bone, put bone graft and membrane, and build bone outside so that the teeth can actually be moved orthodontically to widen some spaces. So for a lower jaw that truly needs widening, and it's not just a matter of tipping, a lot of times that's also a great option to set the person up for wider arches.
Yeah, we're quite familiar with SFOT on my channel, although my audience generally has a preference for Dr. Yousefian's approach of skeletal midline expansion. But he's literally the only guy in the country who does it. And that's very frustrating to people. But the more I ask around, the more I'm learning it's because people are very cautious about, risks to the temporomandibular joints.
Yeah, it's a serious concern for sure. Now, distracting, if I were to advocate for anything, distraction is probably a safer way to do it.
Because you can take it turn by turn. If you're having pain, you turn back. You're going a fraction of a millimeter at a time.
Yeah, and you may give the body has an amazing ability to remodel and adapt. So if you can do it slowly over time, there's a much better chance that's going to be healthy.